So now we're going to be talking about Acyclovir, which we have discussed today already, but I'll just repeat it today. So Acyclovir is going to focus on your herpes simplex viruses, your herpes family. Basically, think of varicella zoster, your shingles patients, all those kind of patients. So it's very specific, your antiviral, so it has a narrow spectrum. It inhibits your viral protein synthesis. So what's the difference? It basically just focuses on viral versus focusing on your bacterial infections. All right, so when you're focusing on these medications, just remember that this is we're focusing on herpes. What it's also important, as Yvette was telling us today, is that these patients are going to be, you have herpes for life if you get herpes. So these patients, it's not that it's going to cure it, it's just going to ease the symptoms and signs and symptoms of basically suppressing those symptoms that are undesirable. So if you, a patient has signs and symptoms that are starting up that are undesirable, they'll try to get the patients to start having these medications to help lower these undesirable effects. All right, so other things to watch for is, because it could be administered IV, is your classic like phlebitis or inflammation. Watch when you're administering for these things. So the nurse's job also, the nurse's job is to watch for that nephrotoxicity risk, which is usually like a lot of bacteria. Bacterial antibiotics have this also with the nephrotoxicity. So that watch those creatinine levels and the BUN levels rising if they're inpatient. You reduce the risk by administering it over an hour, and make sure, so like over an hour is how long they should administer if they're doing a IV route. And hydration, make sure these patients are hydrated. I'm pretty sure there's another medication that said make sure it was hydrated. Wasn't that one? Oh, gentamicin. Yeah. Definitely. It says nurse administer slowly over 30 minutes or more. But I'm pretty sure that one you should also make sure they're, because that's one's really toxic, honestly. But 30 minutes or more. So this one, Acyclovir, says an hour or more. So they're a little bit different. Gentamicin says 30 minutes or more, and Acyclovir says an hour or more. Your clindamycin didn't really have really specifics. It was focusing on the C. diff, and your erythromycin was more focusing on your ointment type. So we don't really know about that one. So this one is just more like focusing on the nephrotoxicity. You also can have IV neurologic toxicity, agitation, tremors, deliriums, hallucinations, myoclonus. So just focusing on the neurologic system. Also, topically and orally are safe for pregnancy. It was classified as a pregnancy category C. Just want to make sure that that's what my mind map said. It does say pregnancy. No. This one says, I found B, but it's actually C because you go by the PowerPoint, so category C. So literally the only thing that it says on the PowerPoint was that you need to focus on what was the precautions. They were just focusing on that pregnancy question. So like what should you watch for a pregnant patient is, it's C, so risk the benefits versus the cons, stuff like that. Yvette today, she really emphasized on the importance of watching for cervical cancer check annually. I'm not really sure the reason why, but I guess anytime you're messing with this, like long-term, you're on and off drugs, it's really anything. Sometimes it can be toxic to the viral or the bacterial, but it can also be toxic to your body. So I assume, why not? Cervical cancer could be a risk. So just something to watch out for, because Yvette told us today. All right, checking out on Acyclovir.